Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, non-arteritic and non-arteritic anterior ischemic optic neuritis. In non-arteritic anterior ischemic neuritis, the major risk factor is hypertension. Here, the patient will have sudden loss of vision, which is painless, seen in the morning episodes, and there is slightly decreased visual acuity is seen. Now, on examination, you see that the optic disc can be either pale or hyperemic, but there is diffuse edema of the disc will be seen, with flame-shaped hemorrhages are seen around the disc. So actually, so this is similar to that of non arteritic arteritic anterior ischemic optic neuritis, where the optic disc is either pale or hyperemic with flame shaped hemorrhages around the disc. Now, how are you going to treat this patient with non-arteritic anterior ischemic optic neuritis? First, we will have to check the factors of viscosity which are affecting uh, and which are responsible for ischemia. So we have to check the factors like fibrinogen and packed cell volume are checked for identifying the cause of the ischemia. We have to check this. Then we should manage the blood pressure and manage the underlying disease and stop the smoking. So this is the picture of arteritic optic neuropathy, non-arteritic optic neuropathy, where the optic disc is pale with flame-shaped hemorrhages around the disc. Then if you see the arteritic optic neuropathy, this is the picture of arteritic optic neuropathy with edematous disc, and these are the flame-shaped hemorrhages are seen. Here we cannot see those hemorrhages clearly.
thank you and thank you for watching.